So I'm pretty sure we've all been to a couple parties, whether they're college parties or high school parties, any sort of parties we've all been to. And I'm pretty sure we've all seen alcohol over there. We've seen drugs over there. We've seen smoking, whether it's marijuana, regular tobacco, or even some of the helium that I've seen famous a lot. So today I'm going to be speaking to you all about drugs, why they're bad, why they are not good for you, whether it's ecstasy, cocaine, methamphetamine, marijuana, and alcohol especially. I'm pretty credible at this. When I was about 14, 15 years old, it had been 2 years that I was stuck on ecstasy, methamphetamine, and cocaine. I had been doing it for about 2 years straight. It started off about one time a week, and then it started to once every 2 days, and then it ended up being 3 times a day. And luckily for me, if I wouldn't have had my mom at my house at the time, my heart stopped. I would have probably been dead right now. So going on to my main points, my first main point. I'm gonna go ahead and show you guys about the most common drugs that we see here at colleges. One of the main ones is marijuana. Some people consider it a drug, some people don't. I consider it a drug if you lose your type of self. If you're not your true self anymore, I consider that a drug because after all, you do lose yourself. Other common one is ecstasy that is shown at college parties a lot. The most famous ecstasy pills I've seen is Superman, the Transformer one, and the Facebook one. I've seen that one a lot recently. Also the Beats by Dre, which I think I started seeing about last year. This one, marijuana, of course everyone knows what that is. Alcohol, that is seen at a lot of parties, a lot of groups start to drink. And then one that is also pretty famous at college campuses are over-the-counter drugs, whether it's Advil or some that have been used for like ADHD. And I like this quote right here that says legal does not mean safe, because yeah, it could be legal, but just like you taking Benadryl, if you take about 5 of those doses, you're gonna be high out of your mind. Now going on to my main point 2, why it's bad for you. As you can see on the top 2 pictures, actually the left pictures, you can see that that's the before and afters of taking ecstasy. They look pretty young at first, and then about 2 years, 3 years down the line, you start losing your color, you start getting pretty wrinkly, you look grumpy, you look like a zombie already. You don't look like yourself anymore. And then right here, the addicts, the before and after of alcohol, weed, drugs, video games. The first one's wrong, that one was actually ecstasy, I don't know why they put that one there. But as you can see, it's pretty bad for you. Ecstasy is, since I'm really familiar with ecstasy, I can tell you guys what that one does. It makes you lose yourself, you start seeing weird things, you start feeling really pale, you don't look like yourself anymore. I remember some of my friends, they would tell me like, I don't look like myself anymore, and I said, well, that's the way I am now. And the truth is, I mean, it's just not good for you. And I think that the reason what that for was like said by, according to Mayo Clinic on February 2nd of 2016, various factors contribute to teen drug abuse, from insecurity and desire for social acceptance. I think that was at my point when I was 14, 15 years old. I didn't know where I was going. I didn't know who I wanted to be. So a group of friends then told me, you know what, let's try this, let's try that. And sure enough, I started doing it just because I wanted to fit in. In reality, that's just not the right way to go. And I believe that it's perfect for me to speak to you guys right now that we're all turning 21 in a couple years, just because that's like the beginning age of alcohol. That's the beginning age where we're all starting to try to figure out who we are. Going to my main point 3 of ways to avoid drug abuse. Again, friends have to do a lot with it. You might think that they are your true friends, but in reality they're not. They're just people that are putting you down. They're just people that are trying to get you in the wrong things. It could be because their own selves are insecure, or because they just want to see someone else suffer, like a bully. After all, that's why bullies work, because they want to pick on someone else because they're releasing their own insecurities. That's a way to avoid it. Another one is just getting active, doing something else. Like you could do a sport, you could go do, whether it's working on something, you could be working on a school project, or even reading. That's a way that it kind of keeps you away from the wrong crowd. Choosing parties, correct parties, is also a good factor. You don't want to go to a party where there's going to be a bunch of drugs, alcohol. That's going to eventually you're going to get into peer pressure. People are going to tell you, you know what, just try it out. You know, it's not that bad. Yeah, it's going to hit you one time, you're going to like it, maybe. Like me, I remember the first time I tried a pill, I was super happy. I felt like Superman. I felt invincible myself. But in reality, you get hooked on it. You might say, you know what, I'm not going to get hooked on it. I'll just keep myself strong and I'm not gonna get to it, but in reality you are. That's just the way pills work. Doctors tell you that for a reason. You get hooked on, and that's the reason why I really wanted to speak to you guys about this, is not to tell you guys that it's the worst thing in the world, because I mean obviously there's worse out there, but when you go out with people and they tell you, you know what, let's just do it, it's fun, and you know, you can hang out with us, you might want to do it to fit in, but in reality it's just not a good thing. It's, if you're always high with your friends, they're not really your friends, they're just people that are acting ridiculous like you. You're not your true self, so how could you say they're even your friends at that point? In conclusion, drugs are bad, just stay away from it, take it from someone who's been through it. Right here, as you can see, that was me in the hospital, but that night my heart had stopped. It's a crazy scenario. I was in the hospital for 2 months straight. I was not able to leave. I was stuck. I was strapped down. They injected me with so many things, and then once the doctors start diagnosing you, they're gonna treat you that way as your life keeps on going. Like now, every time I go into the hospital to even check in with just with the cold or a flu, they tell me, "Are you still on drugs? Are you still doing this? Are you still doing that?" Now, I did also have a police record ever since that point, because they did arrest me because I had about 10 pills on me. Every time I get pulled over by a cop, whether it's from running a stop sign or even having a back tail light out, they're gonna assume that you have drugs in you. They're gonna ask you, you know what, I need to check your car now because of your background, and that's just something that someone shouldn't have to deal with. And I just want you guys to, right now that everyone's going through college and it's our first year, I want everyone to just think about whether you really want this for yourself and whether it is your true self that you're dealing with once you start this.